Hi, I'm Michelle,
And I'm Felicia.
and we're high schoolers at Woodbridge Academy, and we're going to be presenting about mental health. So the first thing is, what is mental health? And that is just your overall state of mind, and it can be affected by many things, like biological factors, whether your parents or your family has had a family history of mental illnesses, and it can also influence our decisions, how we handle stress, and just how we go about life.
And oftentimes, mental health also has a background in the physicals. So your DNA, your genetics also play a role in whether you have some mental diseases. And mental health has been overlooked for a long period of time, and that's why we want to shine some light on this topic.
And there are a number of different mental illnesses, and we're just going to go over 3 very common mental illnesses. So the first one are eating disorders, which is when someone has really abnormal eating habits, and the first one is anorexia, which is when someone is really conscious about their weight and thinks that they're too overweight and they want to lose a lot of it. So what they would do is they would exercise a lot, they wouldn't eat, they would cut back, and they'd have a loss of appetite, so they wouldn't want to eat a lot, and this would be really unhealthy, and people with anorexia are very underweight. And then there's bulimia, which is when someone is also conscious about their weight, and what they would do typically is they would first binge eat, which is eating a lot of food in a short period of time, and then they would right after they would feel really guilty about it, so they would start trying to lose weight in a really unhealthy way, like self-induced vomiting or using things like laxatives. Next are anxiety disorders, which is when someone always feels anxiety or worry a lot, and anxiety can happen everywhere, like when you're at school, work, when you're about to take a test, when you're going to make a really important decision. And when you have a buildup of anxiety, a lot of times people have panic attacks, and during these they would tremble, shake, their heart would beat really fast, and they would start sweating a lot. And then usually people who have panic attacks, they would worry about when their next panic attack would be. Obsessive compulsive disorder, or OCD, is when someone has a collection of thoughts and behaviors that they can't get rid of, and obsessions and compulsions go hand in hand. So obsessions are thoughts that you can't stop thinking about, and then compulsions are behaviors that result of these obsessions. So an example would be if someone obsesses over germs, they would feel the need to always
Clean.
and wash their hands.
Yeah.
And the one that everyone knows is when someone obsesses over making sure everything is perfect and keeping everything in order, they would have compulsions to make them want to always organize and just make sure everything is perfect.
And this is abbreviated as OCD. And if you can tell from the last 2 slides, mental health is oftentimes a learned disorder. Nobody is born with these disorders, and over time, as they have their experiences in society, that's when they learn, like, this behavior is how I want to act, or this is affecting me in a certain way.
And the last one is post-traumatic stress disorder, also known as PTSD, which is when someone goes over something really traumatic and they can't stop thinking about it, and usually people would have flashbacks and they would relive the memory over and over again, and when they're living their daily lives, they would always be reminded of this specific event. And then lastly, mood disorders are when you have distorted moods and feelings, and the first very common one, especially towards our age group, is depression, and this can be very common and people show symptoms of it, but there are also people who are actually diagnosed with it, and people with depression can't concentrate, they feel really sad all the time, and they just don't really feel like doing much. They like to withdraw themselves from activities. And depression can come in many different forms. It can be lifelong or it can be temporary, and then there are also things like postpartum depression, which is when females have depression right after they have a baby, and this can be dangerous for both them and their baby because they feel like they can't take care of not only them but their child. And there's also seasonal depression, which is when you're affected by the seasons, especially during the winter months. You feel really depressed because of the daylight hours and how there's less of it, but it usually improves when there's summer and spring months when there's more daylight. And then there's bipolar disorder, which is when people have 2 alternate moods. They're either really happy, which is extreme mania, or really sad, which is when they're really just depressed, and this can change really easily. And there are 2 different types. Bipolar disorder 1 is more severe because there are longer periods of time where you'll be really happy and then all of a sudden you'll be really sad. And then there's bipolar disorder 2, which is when there are shorter periods of time where you're happy and then sad, and then you can also have a neutral mood. There are many warning signs when talking about mental illnesses, like when you just can't concentrate, you're always feeling sad, and you feel there's changes in your life, like how your eating habits are changing, your sleeping habits, and also your school performance is affected.
Okay, here we have a nice little quote. The evolution of mental illness, however, has not been linear or progressive, but rather cyclical. Whether a behavior is considered normal or abnormal depends on the context surrounding the behavior, and thus changes as a function of a particular time and culture. So I want to ask the audience, what do you think about this? And do you think this is true? Felicia?
I think this is true because you can't okay, if you look at someone who was depressed right now or depressed centuries before, it's different because their surroundings were different, the environment they lived in was different, how they lived was different, it's completely different world. So you can't compare be oh, this person was more depressed and this one was less depressed.
Yeah.
Everything depends on something.
And this talks about not only the evolution of mental illnesses, but also about the treatments and processes by which they were thought to occur. So, do you think that the treatments of mental health also occurs in a cyclical fashion? Which is it repeats in the treatment processes, and they go through a type of thinking where this is like this, and then they repeat it centuries later.
Well, I think it could be both because some things that we use to treat mental illnesses, they could have come from the past, but some things are completely new.
Okay, now we're going to give you a few examples, and we're going to talk about the history of mental health. So oftentimes, back in the day, they tried to explain things that they could not see. And one such event was the illnesses of the brain. See this big blob over here. And when they could not see them, they thought they attributed these to demonic possessions. And they thought demons were the reason why this person was having headaches or epilepsy or random blackouts. So a treatment process that they used was trepanation. And what they did was, if my model could come over, they would take this device and put it atop the head and then drill a hole right in the noggin. And so this process started around 6,500 BC. And as you can see in this depiction over here, this was how they did it. And we have another picture of a trepanned skull, and it looks a little something like this. Oftentimes trepanation was used to cure anything that made you feel unwell or that was related to demonic possessions. And ironically, they used this method to cure headaches, which oftentimes made it worse. Okay, now we can talk about the four humors. So the four humors was a popularized theory during the Greek medical era, which was when Hippocrates came up with this theory. It was that the body was made up of four elements: yellow bile, blood, black bile, and phlegm. And so when these four humors fell out of balance, that was what would result in illnesses. So what they did was they had heroic medicine, a medicine which is used to try to sort of balance these four humors out and make everything in shape again. And one such method was called bloodletting. And in this picture called breathing a vein, you can see the process of bloodletting. So if my model would come over again. So what they would do is they would take your vein, you would roll up your sleeve, tie a tourniquet around the upper elbow, use a lancet to punch a hole in the vein, and then it would come squirting out and you would catch it in a bowl. And so this was believed to relieve the blood segment. Oh, you're going to have to come back.
Okay.
Yeah, okay. The blood segment of the four humors. And this was often used when people were feeling lightheaded, so you would release the blood because blood was believed to clot. So old blood would form into hard rocks that you had to let out. And this process aided in doing that. So next we have something called gentle emetic, which was basically you take a medication that makes you vomit. And that's what an emetic is. So what in this picture is happening is the physician is massaging the patient's head after he just drank the emetic. And he is going to puke into this bowl. And what this would do was it would balance out the biles in the body. so it would help cure another variety of diseases. And lastly, we have something called taking physic. Now, many of you might not know what physic is, but I'm sure you do once you hear the common, you will when you hear the common name. Physics are also known as laxatives. So laxatives are what you take when you're having a really hard time defecating. So what you do is you take them and you can poop better. So what this guy is doing, he has a laxative in his hand, he has some on the counter over there, and he's drinking it. And from the picture you can see he's like frowning, he looks really sad, he's like, ew, this tastes really bad. So you can tell that physics back then were really disgusting and they tasted really bad, but it would help him aid in his defecating struggles. So that's what he was doing. And this is a nice little cartoon about bloodletting, trepanation, and mercury poisoning, which is another type of heroic medicine. And in this story, we're going to tell you a little story. So in this story, George Washington went out on his horse one day in his plantation. Yes. And he got really, really sick. And he started coughing uncontrollably. He couldn't really breathe. So then what happened was he's like, take some of my blood out. It will help you. It will help me. So then what the physicians did was they drew out 5 liters of his blood. And then he died. So that's bloodletting. So you can see that heroic medicine, even though it was back in the early ages, it wasn't just for that specific time period. Rather, it was a process that continued until the time period of George Washington, which is someone we still know today. Next, we have trepanation, which it's just she has a headache, they drill her head, she dies. Last one was the story of Qin Shi Huang. So this was a Chinese king, and he believed that mercury would make him immortal. So what he did was he drank mercury elixirs, he took mercury tablets, and eventually he ended up dying. But he died. When he died, he ordered his soldiers to bury him in a bed of mercury. The irony. You can go to the next slide. Now we're going to talk a little bit about mental asylums. So you can see this kid is trapped in a cage, and mental asylums of the past are very different from mental asylums of today, because they were seen as a way to separate the mentally ill from the rest of society, much as prisons were seen as a way to separate the healthy from the criminals. So this person is being trapped inside a cage. Yes, we talked about it. Okay, and one of the methods they used was hydrotherapy. So what they did was they put the patient in a bath. So imagine there's a bathtub right here. They put her, she would sit down, and they would strap her in. So she would have a bunch of buckles strapping her to the side of the bathtub. And then they would pour ice cold water in. So and then they would cover her with a canvas so that she couldn't escape or get out in any way. And as you can see, that was a really cruel, inhumane method, and that's what's being shown here. You can see the little straps on the side, the little head poking out, the canvas. And other forms of hydrotherapy included mummifying the patient in a wet cloth. So what they would do is they would take you and they would wrap you in cold cloth. So cold. And then another one is being sprayed in cold water, which is in the next slide. So this one, a man is standing butt naked against a wall, and he's being sprayed with alternating blasts of hot and cold water so he can be mentally cured of his illnesses. Lastly, they use something called restraints. And you can see he has a buckle around his neck, he has something around his head, and he likely has one around his waist as well, and his hands. And so what this did was it was originally used to keep patients from self-harm, so they wouldn't like scratch themselves, tear at their faces. But as mental asylums got more crowded, and as it was seen more as a place just to dump people rather than a place for treating patients, it was used as a means of control. So anyone who was acting out or who they wanted to punish of sorts, they would use restraints for. And today that practice has been long banned, though restraints are used only to keep patients from self-harm. Here's another inhumane restraint method. It's called the Utica crib. And this was used for full-grown adults, and it was a 3-foot by 18-inch by 6-foot crib that you would lock a human in. And what happened was when patients were having a temper tantrum or really going crazy, they would lock a patient inside this crib, and they would be calm after they came out. And oftentimes doctors forgot that the patients were even in there, so they died. Okay, now we're moving on to some more modern treatments. This one's called electroconvulsive shock therapy, and it's a very effective treatment method, and it is still being used today. So what they do is they take, come here again. So they take the patient, they lie them down on a bed, and what they do is they shoot some muscle relaxants into you, some anesthesia so you don't feel any pain, and then they hook up some electrodes to your brain. And they put an ankle cuff around your ankle so that they can monitor the spasms. And the intensity of the spasms shows the intensity of the seizure. And then they turn the electrodes on and they trigger a brief seizure. Now this sounds really, really dangerous, but it's actually very effective. And even though we still don't know how exactly it works today, we know that it's very effective in treating depression, especially clinical depression. And this is a picture of electroconvulsive shock therapy then versus now. So electroconvulsive shock therapy has a very negative stigma around it, and this is because back then it was used in a very dangerous way, because they would apply a lot of electricity and shock you really bad, and from that patients often die. But today it's applied in smaller waves, so it's more safe and it's really good treatment. And that concludes the end of our presentation, and we hope you learned all about mental health.
So does anyone have questions? Felicia?
You know that slide where you mentioned like they spray the patient with like hot and cold water?
Mm-hmm.
What was the point of that? Like, why did they think it would work?
They thought it was a good treatment, and a lot of people came up with a lot of really crazy treatments, and one of them that wasn't on this slide was insulin coma therapy, where they injected insulin into you so you could have so your blood sugar would drop and then you would become almost crazy, hallucinating. So back then people thought a lot of things were normal.
But what did they think that spraying the water would treat?
Their brain.
Okay.
You're welcome. Any
Yeah.
questions?
I have a question. How do you tell whether a person is mentally sick or pretending to be mentally sick?
So there are a lot of diagnostic tests, and there are cameras. So of course, if you're in a hospital and you're being treated for mental sickness, there are a lot of tests that can be run, and you can also keep track of them to make sure they actually are mentally sick. And oftentimes there are a lot of warning signs that show that this person is sick or this person is pretending. Any other questions? Risha?
Is there like a specific place that you think most of the treatments came from?
Most of the treatments,
That like you research came
oh.
from?
Well, most of the treatments explained here were from the 19th century, and then the other two were from way back before when. So I just wanted to give everybody a little bit of insight onto back then versus more recent. And you can see that even though it's more recent, it's not necessarily more humane. So a lot of these treatments just came from what scientists believe to be true. And scientists believe a lot of incorrect things as true.
Yeah, but even now there are other forms of treatment like psychotherapy where you can just talk to someone who you trust about how you're feeling, or there's medications that you could take like antidepressants.
Any other questions? Okay, thank you.
All right, thank you.